Welcome back to my channel. If you are visiting this space for the first time, you are also highly welcome. This is where we simplify anatomy, and here we also learn anatomy with so much fun. In this lecture, we'll be looking at the quadratus femoris. Using this image by the side, this is where we have the quadratus femoris here carried at this point. This is the most inferiorly placed muscle around the deep gluteal region. In this lecture, we'll be looking at how this muscle originates and also where it finally inserts upon. We'll also be highlighting some details that you should know as students of anatomy. The quadratus femoris is what is harrowed here in green. We say that this muscle is the most inferiorly placed muscle around the deep gluteal space. This was what we highlighted in our previous slide. This muscle is a paired muscle, which means that it is seen on both the right and also the left side. It is also flat and also rectangular in shape. Quadratus means a four-sided configuration, and femoris because it takes its insertion point on the femur. And we'll be saying this as we go through with this lecture. This muscle is the most inferiorly placed muscle within the deep gluteal space. To go back to our lecture on the gluteal region, in that lecture, we classify the muscles of the gluteal region into two compartments. We say that we have the deep compartment and also the superficial compartment. As the name implies, the deep compartment is embedded deep within the gluteal space, while the superficial compartment is seen to be superficially placed. The superficial compartment is seen to run superficially over the deep compartment. If you look at this image by the side, this is the deep compartment of the gluteal region. This is where we have a collection of muscles coming together to form the deep gluteal muscles. And this is what is exposed here in this image. And this means that the superficial compartment will be seen to be overlying on the deep compartment. So in this image, we have the deep compartment exposed. And if you look at the most inferiorly placed muscle here, it is the quadratus femoris. And it's good for us to highlight the other muscles that are located within the deep gluteal region. If you look at this muscle that is harrowed here at this point, this is the obliterator internus muscle. The obliterator internus muscle is what is seen to be highlighted here in red. If you go more superiorly above the obliterator internus muscle, we have the superior gemellus muscle. While inferiorly, we have the inferior gemellus muscle. And what this presents is that the obliterator internus muscle is seen to be located or positioned between the two gemelli muscles. So you see it forming like an intersect between the superior and the inferior gemelli muscle. So this is how it is positioned around this region. If you go more superiorly, you have the piriformis. The piriformis is what is seen to be carried here in yellow. If you go more inferiorly, below here is where we have the quadratus femoris. And this is what is harrowed here in green. So you see that we have a number of muscles, coming together to form the deep compartment of the gluteal region. So this is where we have the quadratus femoris here, harrowed in green. We would be driving into the details on how it originates and also where it finally inserts upon. So let's drive into how the fibers of this muscle originate. Using this image by the side, this is where we say we have quadratus femoris here, harrowed in green. This muscle is seen to originate from the lateral upper aspect of the ischial tuberosity. This is where we have the ischial tuberosity here, harrowed in dotted black, but specifically it is seen to originate from the lateral upper aspect of the ischial tuberosity. We know that the ischium forms one of the structural components of the hip bone. The hip bone is formed by the ilium, the ischium, and also the pubis. So at this posterior region, we have the ilium, and inferiorly at this posterior region, we have the ischium. We say that the pubis is located in the anterior region. We've tried to highlight this fact in our lecture on the bony pelvis. We've also checked that lecture up. Please kindly go and do so. So we have the ischial tuberosity around this region, and the lateral upper aspect that is harrowed here in dotted black is where we have the fibers of the quadratus femoris originating from. And you see that after their emergence from this specific region, they are seen to be directed laterally. And laterally, you see them crossing over the hip joint. And this is where they are finally inserted on the quadrate tubercle that is located on the intertruncateric crest. And this is what is harrowed here in dotted black. This is where we have the greater truncator. This is where we have the lesser truncator. So between the two truncators, we have the intertruncateric crest. Specifically on this crest, we have the quadrate tubercle. and it is where this muscle will finally be inserted upon. So you see that the fibers of this muscle originate from the lateral upper region or aspect of the scale tuberosity and are directed laterally before they are finally inserted on the quadrate tubercle that is located on the intertruncated crest. So these are the specific details on how these fibers originate and also where they finally insert upon. And if you look at the pattern by which the fibers of this muscle run from where they originate from and where they finally insert upon, you see that they are seen to be crossing over the hip joint. So deep to this muscle, we have the hip joint crossing posteriorly over the hip joint. So deep to this muscle, we have the hip joint. The hip joint we know is formed by the head of the femur that is fixed into the acetabulum. So this configuration is created deep to this muscle. It's important that we highlight this because we would be expatiating more on this as we go through this lecture. So let's look at the relations of this muscle. What are the structures that are related to this muscle? Remember that this is where we say we have the quadratus femoris here, the most inferiorly placed muscle within the deep gluteal space. And of course, we say that we have a number of muscles, coming together to form the deep layer of the gluteal region. We have the obliterator internus muscle here that is arrowed here in yellow. And superior to the obliterator internus, we say we have the superior gemellus. Inferiorly, we have the inferior gemellus. Superiorly, up here, we have the piriformis. And inferiorly, down here is where we have the quadratus femoris. These muscles will come together to form the deep compartment of the gluteal region. We've highlighted this in our previous slide. So these are the relations of this muscle within the deep gluteal space. And this muscle will be seen to be overlined by the superficial gluteal muscle. We have a number of muscles also that will come together to form the superficial compartment of the gluteal region. And this is what will be seen to overline on this deep compartment. Within the superficial compartment, we have the gluteus minimus, we have the gluteus medius, we have the gluteus maximus, and we have the tensor fasciae lata. All these four muscles will come together to form the superficial compartment of the gluteal region. And this is what will be seen to be overlying on this deep compartment. We also have the sciatic nerve. The sciatic nerve is seen to exit the pelvic cavity through the infrapiriform foramen. This is what is highlighted here in yellow. And upon its exit, it is seen to be running posteriorly over the quadratus femoris, crossing over the quadratus femoris. And this is what is shown here in this image. We also have the adductor magnus. The adductor magnus muscle is what is seen to be highlighted here at this point, and it is seen to be located just inferior to the quadratus femoris. This muscle is seen to form the muscular compartment of the medial region of the thigh. Remember that this lower head here is where we have the lower limb or the thigh, and this medial aspect is where we'll be seeing the adductor magnus, and this is specifically located inferiorly to the quadratus femoris. So it's part of the structures that are related to the quadratus femoris, but it is specifically seen to be located inferior to this muscle. Remember that superiorly to the quadratus femoris, we have the inferior gemellus muscle, and this is what is arrowed here in blue. So inferiorly to it, we have the adductor magnus muscle, and this is what is highlighted here at this point. Then we have the cruciate anastomosis. This cruciate anastomosis is a collection of arteries that are seen around the insertion point of the quadratus femoris. This is where we have the final insertion point of the quadratus femoris. We say that this muscle is seen to be inserted on the quadrate tubercle that is located on the intertruncated crest. And this is where we have the intertruncated crest here, around this region between the greater and the lesser truncator. So at this point here is where we have a collection of branches that will come together to form the cruciate anastomosis. We have branches from different vessels that will be coming together to form this anastomosis just around the insertion point of the quadratus femoris. So we have branches from the medial and lateral circumflex femoral artery. These are branches from the deep femoral artery, which of course originate from the femoral artery. We know that the femoral artery is a branch from the external iliac artery. It also receives contributory support or branch from the inferior gluteal artery. We know that the inferior gluteal artery is one of the branches from the anterior trunk of the internal iliac artery. This cruciate anastomosis is also supported by perforating branch of the deep femoral artery. So if you look at where these branches come from, you see that they emerge from branches that originate from both the internal and the external iliac artery. And this anastomosis is so created so that when there's blockage from the external iliac artery through the femoral artery, the vessels will be supplied by the contributory branch from the internal iliac artery. So when we have blockage from one end, blood will still be received through the other end. And that's the essence of the creation of this anastomosis. So we have this anastomosis created from branches from different vessels that would emerge from both the internal and the external iliac artery, just around the region where we have the insertion point of the quadratus femoris. And this is what is highlighted here in dotted red. So let's drive further to highlight the actions of this muscle. This muscle is seen to contribute to external or lateral rotation of the thigh. We know that we have a number of muscles around this region that contributes to external or lateral rotation of the thigh. And this is one of the muscles that acts in this regard. So basically contributing to external or lateral rotation of the thigh, we have the obliterator internus, we have the superior and the inferior gemini muscle, we have the piriformis, we have the obliterator externus, then finally we have the quadratus femoris. So all these 6 muscles are seen to contribute to external or lateral rotation of the thigh. So it is important that we also highlight the other muscles that also contribute to this action. It is also seen to help stabilize the head of the femur in the acetabulum. Remember, we have the creation of the hip joint deep to the quadratus femoris. We tried to highlight this in our previous slide, that considering the pattern by which the fibers run from where they originate from to finally where they will be inserted upon, they are seen to cross over the hip joint. And this is where they cross over it at this posterior region. And because of this, they're helping to reinforce the joint that will be created between the head of the femur and also the acetabulum. And this is what leads to the creation of the hip joint. So it helps to stabilize this joint around this posterior region. The quadratus femoris is supplied by the inferior gluteal artery. The inferior gluteal artery is one of the branches from the anterior trunk of the internal iliac artery. We've also tried to establish or describe how this artery emerges from the anterior trunk of the internal iliac artery in our previous lecture on the internal iliac artery. You can also go and check that lecture up. So the branch that supplies the quadratus femoris with oxygen and nutrients is the inferior gluteal artery. And it is innervated by a corresponding named nerve, which is the nerve to the quadratus femoris. And this nerve to the quadratus femoris is an emergence from the sacral plexus. It emerges from the sacral plexus, specifically from the ventral divisions of the ventral rami of L4, L5, and also S1 spinal nerves. So this is how this nerve emerges, and this is what innervates the quadratus femoris. This nerve to the quadratus femoris is not seen to only innervate the quadratus femoris, it is also seen to innervate the inferior gemellus muscle. So this is what is harrowed here at this point. This inferior gemellus muscle is located close to the quadratus femoris, and this is why it is seen to also enjoy the innervation of this muscle. So you have the same nerve innervating the quadratus femoris and also the inferior gemellus muscle. And these are the muscles here harrowed here in this image. So thanks for watching this video. Let's continue to stay glued to this channel.